All right, so doctor, I recently watched a news story about a lady that was struggling with what we're talking about, obesity. And she was going for what they described as life-saving weight loss surgery. So what about surgery? It's becoming a common thing. It's becoming a thing that people are picking up a lot, especially people that are struggling. What about it? Does it actually follow the science, like you're saying?
So, life-saving, first of all, what does life-saving mean? I just want to make sure that we are on the same page.
If you don't do it, you will die.
Okay.
Life-saving.
Okay.
Save your life, literally.
Okay, so gaining weight is going to cause insulin resistance, ultimately. Insulin resistance is the disease. The symptoms are high blood pressure, high blood sugar, abnormal levels of cholesterol, fatty liver, and so on. And then there are complications. The two most common causes of chronic kidney disease are high blood sugar, high blood pressure. If your kidneys get damaged to the point of no return, you need a kidney transplant. Liver damage can also happen if it's to a point of no return, you need a liver transplant. And you could die from a heart attack or a stroke. So yes, losing weight is a life-saving venture. Surgery being a life-saving procedure is questionable. Because the question I would ask is, I'm always about the cause. What are we dealing with? And that's why I keep asking why? And for some people, it annoys them. But it's fine. I keep asking why because I want to know, or what are you trying to achieve? So, this person has gained weight. How does someone gain weight? Again, it's hormones. It's hormones. Whether it's you were born overweight and you've now been overweight all your life, your mom is one was eating the wrong food. So her insulin spiked and then you gained weight. Again, as I said, there are some disorders, but again, that's a very small percentage of the cases. For the bulk of people, it's the hormones. So you started out, or let's look at somebody who started out small. They started out small, they started eating the wrong food. They started eating the wrong food, too much food. Like Timothy, you told me a story of someone on was it a show on TLC or something like that?
Yeah, actually, I wanted to give you that example.
Yeah,
Watched. I don't know if you watched. There's a show on TLC. I've just forgotten what the title is, but they show individuals that, mostly, of course, in the US, that are struggling.
Yeah.
That are really, really struggling with their weight. Most of these individuals weigh anywhere between 300 to 400. There's an individual that showed that weighed 600 kilos.
Oh
yeah. So, and which then actually got me thinking about this whole surgery thing. So for someone like that, he weighs 600 kilos.
Yeah.
Surely these types of surgery are life-saving. Surely it is the need to do it before. I mean, you could do the surgery because, I mean, if I weigh maybe 100 kilos or maybe 120, okay, yes, I could start with a lifestyle change, address all those hormones you're talking about. But I weigh 400 kilos. I'm not sure I have time to deal with hormones.
Yeah.
How about we do the surgery and then solve the immediate problem, because I'll probably die at 400 kilos. I can't move, can't do it. So do the surgery and then maybe we can begin to look at the lifestyle change. Wouldn't you think that would be a better approach?
Yeah, so if I just take it back to the point of what's the cause? So your normal weight, you start eating too much food, the wrong type of food, more importantly, you start gaining the weight. Now, it's this journey of weight gain exists on this kind of continuum. So you eat too much food, eat the wrong food, you gain weight. If I capture you at this point, the 600 kilogram person. Actually, you told me that he would eat how many boxes of donuts and then how many drink,
Yeah, they
how
would
many bottles
show
of soda.
they would show some of what his eating regimen was. Then one would start out with 3 or 4 boxes of 3 dozen boxes of donuts.
Okay, and without mentioning names of sodas, you just say soda, not the names, yeah?
Sodas, 2-liter bottles of soda. His mid-morning snack would probably do about 12 chocolate bars.
Yeah.
Then he'd go in for lunchtime, would probably be about 10, 15 burgers with
So,
their sides.
yeah, yeah.
And
So,
like that,
so
like
just
that,
leave it
like
there.
that.
That's really enough.
So they are probably consuming anywhere between 12 and 15,000 calories
Yeah,
a day.
a day. So if you get that person at that point, their problem is they're eating too much. Now, eating disorders, eating too much, eating too little. Let's focus now on the eating too much. Hyperphagia. There are different causes of that. One, it could be a psychiatric problem. There could be some imbalance of some of these neurotransmitters. It could be a neurological problem. There could be a tumor somewhere. You see, there is central command, which is your brain, and then there's local command. So the surgery for weight loss is we're looking at the bariatric surgery affecting the stomach. Local command, central command. So you can, when you do, like particularly that's the gastric sleeve, I think is one which is becoming quite popular amongst people. The gastric sleeve is going to remove about 60 to 70% of your stomach. Those, in the lining of that part of the stomach which is being removed, those cells there produce the hunger hormone ghrelin. So it makes you feel hungry. So the idea again is that you're removing 60%, 70% of the stomach, removing a bulk, reducing levels of the hunger hormone, hence people stop feeling hungry as much. Also, the size of the stomach is reducing. So which means also you feel satisfied quicker. So again, it's all trying to make sure that you feel satisfied. It's affecting your satiety levels. But satiety is not controlled only locally. It's also controlled, more importantly, centrally. So causes of hyperphagia, if there's a tumor there, if there is, maybe you had trauma, you had a car accident and you damaged that part of your brain which controls satiety. If you had surgery and then they by mistake damaged that part, you had brain surgery and then they damaged that part, affected it in some way. Is you removing part of someone's stomach or putting a band, is it going to solve the root cause of the problem? Timothy?
It doesn't seem like it will.
Yeah, so it all comes down to what is the cause. So if it's psychiatric, so imbalance of certain neurotransmitters, if it's neurological, there's a tumor, there is damage to that part of the brain. If it's drugs, some antipsychotic drugs can actually cause you to have increased appetite. If it's those, you cutting out that part of the stomach is not really going to help. If it's just a lack of discipline and for you, like everything else is fine, it's a lack of discipline. Probably if you're at this point of the spectrum, you've been eating 10,000 calories a day. If you reduce the size of the stomach, it may help to curb that hunger feeling which you have. And therefore, initially, it probably will help you lose some weight because you're not as hungry as much. So which means you most likely will not be eating as much. However, somebody who gets to 600 kilos and just says, you know what, enough is enough, it ends today. He throws out all the burgers, all the chocolate and what? Because they've been eating way more than their body needs to maintain its function, they're going to drop their calories. They are going to lose weight. And that's why I say, I'm always interested when I speak with someone, at what point in their weight loss journey are they? Have they increased the weight all up to this point and have not yet done anything to lose the weight? If they have, for that kind of person, what they need to start doing is just eat less and burn more. It will actually start to work, at least initially. The point is you need to eat less, but you need to eat the right type of food. That's where the problem comes. But anything you do at that point is going to make you lose weight. And that's why, yes, you can go for juicing. Will it help? If you're that person, yes, it will initially. You can go and do lots of cardio, Zumba, jogging, swimming. Will it help? It most probably will. You can fast. Will it help? It most probably will. However, most of the people who I speak to don't approach me at the point when when they are at this point where they've gained all the weight and they haven't yet done anything, many of them have tried something, juicing. They have tried fasting too much, taking unnecessary pills. Some have even tried things like Ozempic and so on. I've had people who have even had the gastric surgery, the balloon or whatever. They've had those procedures done. And then, so they come at the point they were losing the weight. So what those things were doing is they were making them to eat less. You understand? They're eating less calories. So they lost weight initially, yes. However, they plateau at a certain point. Why? Because how those things work is they normally cause you to drastically reduce the calories which you're taking in. It stresses your body. We talked about it. Cortisol levels rise. You lose muscle. So even when you lose a lot of muscle, a lot of weight initially, a big chunk of it is muscle. No program should make you lose. You shouldn't lose weight, and in that process have more than 10% of that weight lost being muscle. Now, things like Ozempic are going to cause you to lose, you can even lose up to 40% of that weight being muscle. So that's why you lose weight very, very quickly. If you're losing more than 1.5 kilos of your weight per week, you're most likely losing muscle. So, and that's why I say in a month, if you shouldn't be losing more than 6 kilos. If you're super big, you're 120, 130, 140 kilos, 150, and so on, I may give you some bit of allowance up to maybe 2 kilograms per week. I wouldn't want to give it too much allowance because if you crash your weight like that, you mess up your metabolism, you mess up how your hormones are functioning. Now, if you go for surgery for that gastric sleeve or whatever, at that point, when you're on that, when the issue, again, what's the cause of your failure to lose weight? Because normally people who plateau, they actually start gaining because your metabolism crashes. We talked about this. You're used to depending on few calories. But then now, as I said, many of those people still are going to cheat here and there, even when they are fasting. When they break the fast, they break with the wrong things. They eat more than they need. So they are big. They should need a lot of calories. I usually give this example. A company which has 500 employees versus another of equal caliber, status, brand, and so on, which has 100 employees. Company with 500 employees, 100 employees. Same salary scale. Which company has a higher budget for its staff? Staff salaries. Timothy, 500 or 100?
Probably the one is 500.
So 500, yeah. It's the same thing with us. I'm 39 years old. I'm about 73, 74 kilos. 72, about there, normally oscillate about there. Another 39-year-old man, African, so everything is basically the same, who is 100 kilograms. Who do you think needs more food to sustain their weight? 100 or me, 73? Who do you think? Timothy, tell me.
I'm tempted to say the one with 100.
Yeah, it's that. You see, you have a bigger mass of body on you. Now, and that's why I tell people if you're not eating at least 3 meals regularly, you're not eating enough. So I tell people if you want to eat smaller portions, first lose the weight. And to lose the weight, if you're the person who's now on that descent, you first tried starving yourself and then you've plateaued, the worst mistake you can make is try and do something else which deprives you of calories. And that's what the surgery is going to do. So for that person, it depends where they are. Yeah, it depends where they are in the journey. That determines what the approach is. For the person who has gained up to 600 and then hasn't yet tried to do anything, surgery could help, but they have to be willing to live with the complications. There's a risk of bleeding. Your stomach is never going to get back to its size later on. So that means it's going to be smaller, which means you're going to have long-standing issues to do with symptoms of reflux, burning, epigastric pain, pain in the upper part of your stomach, your throat, like irritations there, bloating. That's going to be something which you're going to have to live with. Also, you're going to have to supplement most likely for life. Not most likely, you're going to have to supplement for life. Why? In the lining of the stomach, there's something called intrinsic factor. It's a compound which is produced, a molecule which is produced by your stomach cells. And that factor helps you absorb vitamin B12. Vitamin B12 is important for nerves and several other functions. There are other micronutrients, iron and so on. Also your macronutrients. Smaller stomach means you can't eat as much also. Food is not the enemy, friends. It's not. The right food is actually medicine. If you're at this point and you're in the crescendo, you are losing the weight, but now you're plateaued, and then you notice it's starting to creep back. Don't get into anything which is going to deprive you of calories any further. Actually, what you need to do is start to eat more to boost your metabolism, but eat the right food, because the right food is now going to shift the hormones back into the right place. So where cortisol was high, if you start eating the right food, cortisol levels are going to drop. If you start sleeping, the right food is going to help you sleep better. It's going to help you exercise better, perform better, help the muscles perform better. You're going to sleep better. Cortisol levels will start to drop, which means you'll be more able to build muscle. Insulin levels are going to start to drop, which means instead of you gaining fat, you're going to start losing fat. So it depends on what point of the spectrum. The person who's on this, who has already been depriving themselves, please, I wouldn't recommend that. And again, even for this person who probably could do it, but needs to live with the repercussions, what was the root cause? If there's a tumor in your brain or something, having that surgery is not going to solve that issue. Those higher levels of hunger and failure to get satisfied are going to persist. Yeah, so you need to understand. Do your homework first. Beyond, actually, even beyond what I tell you. I'm Christian. There's this thing in the Bible where Paul was preaching to the Bereans. And one thing he liked about them was that even with the glamour of Paul, like this was the super apostle, the man preaching the word of God and what, the Bereans, even after listening to super Paul, they would still go back and check to confirm that what he's saying is true. So please, don't even take what I'm saying. Please, don't take it as gospel truth. Go and check it out for yourself. And when you go to somebody else who's telling you, no, this is the best thing for you, it's your life, please. First, do your homework. First, do your homework. Make sure that you're actually informed. Yeah.
So, doctor, are you saying, because what you're saying is slightly confusing. It's slightly confusing. You're saying, if I've gotten you well, that if I am overweight, reducing the amount of food I am eating is not going to help. I have to continue eating the same amount of food because I am bigger. Is that what you're saying?
If you'd like to watch the full video, click here. If you'd like to watch another video by us, then click here.